Michael Howard, welcome. Michael, to you first. Just talk to me, if you would, about the role and the work that Precision is doing.
Yeah, so Precision Neuroscience is developing a brain-computer interface. A brain-computer interface is an implantable device that allows people to control computers with thought alone. So, actually the first one of these was implanted 20 years ago, and people have been able to send text messages, send emails, browse the internet, do online banking, all using only their minds. But over the course of the past 20 years, fewer than 60 people have had the opportunity to benefit from this sort of technology. And we are part of a movement of companies that are taking something that has worked in kind of academic settings, in academic laboratories, commercializing it, and scaling it to the millions of people who could benefit from this sort of technology.
Wow. Howard, what role are investment firms playing in advancing innovative technologies like this?
Well, investment firms are the ones who are able to fund these things and give them the several years' worth of runway they need to go from the idea to the prototype and then later on to FDA approval, so we can actually put these in people with regularity and safety and so on. And that takes bolder investors than they're not ready for the public markets yet. They're too risky. So we like to take on those risks, but we hope they're prudent risks.
How quickly do you think this will be scalable?
So we're already in clinic. So we've actually done 14 implants so far across 3 different medical centers in the United States: West Virginia University, Penn Medicine in Philadelphia, and Mount Sinai in New York. So far, these are implants that are happening temporarily, so people are implanted for a matter of hours. That's really to establish the safety and the efficacy of our systems and to start training the algorithms. And it leads to longer-term implants in coming months, first days, then weeks, then months, and eventually chronic system.
More broadly, Howard, what are you looking for? What key factors are you looking for when choosing where to invest?
Well, we're looking for things that can both help change the world for the better. In this case, there are a lot of healthcare applications that may make quadriplegics be able to control their limbs and walk, may make ALS patients able to speak. And so those are the kinds of things we like to see. We call them the moonshot bets, where if it works, it really both improves society and can be extremely lucrative.
Michael, finally, what are some of the advancements that you're most excited about in this space? There must be so many.
Well, I mean, I think, as Howard mentioned, this is a company that is focused on making a real positive difference in people's lives. And there are many hundreds of thousands of people who, as a result of paralysis or degenerative diseases like ALS, really struggle to move and struggle to communicate. And I think the technology that we're developing has the potential to make an enormous positive difference in their lives.
Fantastic. Michael Howard, thank you so much for your time.
Thank you.
Thank you.